Deshmukh is there. Suril? Suril?
Vandami.
So now we can start, okay?
Yes, yes.
So, yes. Will you start or should I start from my side?
Even I can start. It's not a problem.
Yes.
Jai Jinendra, everyone, and welcome to our new Preksha and Yoga Meditation camp. And this one is a 6 weeks online course. If you are free and want to join in person one, then we can also. You're most welcome to Jain Center here, Jain Bharati, Orlando. So, and this course is basically designed for those the Preksha meditation. This year is we are celebrating in a JVP as a Preksha year, and with this the immense guidance from Mahashramanji, Acharya Sriji, and Shramni Chaitanya Pragyaji, who is an innovator for this the course. We bring you up this the course. So with this now officially we open this course for everyone, and let me introduce to our faculties of this the course. We have our main faculty is Shramni Dr. Chaitanya Pragyaji. She is a professor and also former head of the Department of Comparative Religious and Philosophy at Jain Bharati, Ladnu. She is also expert in a Preksha meditation. She is also a reputed scholar of Jainism, comparative religion and philosophy, science of living, non-violence, meditations and spirituality, Sanskrit and Prakrit languages, as well as the literature. So fortunately, we have a very, very good and immersed, knowledgeable Samniji with us who guide us into this the entire journey. She is also has been working as a Jain nun and a professor at JVBI, Ladakh, since the 1986. She taught meditations and spirituality at Florida International University, Miami, USA, for 7 years. She has also taught at North Texas University and Ghent University of Belgium. Since the 2014 onwards, she is engaged in developing scientific studies in the field of Jainism and Preksha meditation. In her work, she addresses questions of happy blending of science and spirituality, with the special references of Jainism showing a resemblance and resistance. She has created a good network among philosophy experts and scientists at the international level through International Conference on Science and Jain Philosophy, organized with great success, first at IIT Bombay, Mumbai in 2016 and in the second at FIU in 2021. So I heartily welcome Swami Chaitanya Pragyaji. And do we okay. And do we have Dr.
Raj.
Devendra Pai? Do
Dr.
we
Raj.
have Devendra Pai also up here one?
I think Dr.
Le-
Raj is with us. So for today,
okay,
so you have
no
to.
problem.
Yeah.
So we can start with our other faculty, Dr. Raj Mehta. So Dr. Raj Mehta is a MD and is also a board certified in a family medicine and a clinical informatics. He is committed to using a technology to improve how healthcare is delivered and is dedicated research and educator. He cares for people of all ages, from newborn to seniors, and treat each person as an individual. As an associate program director of a family medicine residency program at Advent Health Medical Group, Dr. Mehta helps residents to get the most from their program. So I'm welcoming Dr. Raj to the our program, and so welcome you. And we have a Krishna Desmukh. Vandami, can you please
Yeah,
introduce Dr.
he's
Krishna?
he's a yoga trainer. And would you like to say something, Deshmukh, about yourself?
Sure. Umaram. I am Krishna Deshmukh. I was working with pharmaceutical organization. I did my BSc in biology. Then I also did pharmacy, that is diploma of pharmacy. After retirement, I retired from the pharmaceutical industry and then I joined Preksha in 2013. So I have been associated with Preksha for last 11 years. In these 11 years, I am regularly attending the classes, plus I am teaching or taking the yoga classes also. I am teaching MA, MSc students, especially anatomy, physiology, sometimes the other subjects too, even psychology also. I have done my level 1 as well as level 2 and completed MSc in Science of Living, Preksha Meditation and Yoga. Now I've been associated with this Preksha Dhyan, and even I have attended some shivers also. Bangalore, I attended 2 shivir, one at Calcutta. Lucknow also had 1 shivir, and that's how I have been associated. And I would like to put in one sentence that I firmly believe in Preksha meditation or Preksha Dhyan because I have been benefited with this. I I want to add here, rather I shouldn't have told, but I would like to tell here that during Corona period, I had a Corona infection and then I got admitted to hospital. And someday, one morning, I got up. I don't know it. I'm not aware of it because whatever I have been told that I am recollecting. So my blood pressure went down and I fell down straight away on head. So I had a severe head injury. Normally, in such injury, a person cannot come back. But I was in coma for some time and then I recovered. And as you can see now, I am fit, quite fit rather, and I am once again practicing Preksha meditation. I give this total credit of my life to Preksha meditation, or Preksha Dhyana. That's how I have been, and now it has given me a firm belief that it is certainly helping us. That's how I have been connected with Preksha Dhyana, and it is completely without any intervals. It is completely, I joined in 2013 and I am continuing regularly. So that is all about me.
So, thank you very much for introducing yourself. So, Deshmukh would be the yoga trainer. He will he will teach all the yoga practices which would be required for particular diseases. So, just he joined today for this program. Now I would say about Dr. Surya. He is associated with these Google different courses, and he's handling the technological part also. He's expert in Jainism also. So I would like to request Dr. Surya to say a few words about yourself so that all participants can come to know about you also. And you can also say about the technological part of our Google Classroom, so that nobody should have any problem in accessing the course material, videos, and other informations. So, Dr. Suri.
Thank you very much, Vandami. I am Suril Lakhani, and basically I'm from India, and I moved here in the US in 2007. I did my master's in finance, and then after doing all works up here one. But since there's I was very much born in as a Jain family, so that means we got those the Jain sanskars comes with us. But since the COVID hit up, that turns my life, because we have lost so many dear ones up there one, and that uh, forced me to think about it. What is this the real one? And in a life, balancing is much more necessary. That is what I have learned, right? Because we have one path is our spirituality, another path is our family life, third path is our career, and somehow we are even not making any kind of those the balancing. So how we can got this the balancing? So since the 20 sorry about that one. Since the 2019, I've been in touch with Vandami, and Vandami is very keen to developing or different kinds of the courses of the Jainisms in the US one, and motivating the so many peoples. And with the immense knowledge, I joined with their journey and learned so many things up there one. So I am handling basically all other stuff first, as well as the technological part here one. So anyone has any difficulties to joining a Google Classroom, please reach out to me, and I will love to help you guys to join on this the cars, and welcome you all again in a Preksha meditation. So welcome you all, and we officially open this the forum for everyone. So before we go to this the technological portions of the course, I have a quick questions for everyone, right? Do you have access to our Google Classroom?
Yes.
Yes.
Yes, right? Very good. So even though if no one has an access, and they have just joined to this the Zoom meeting directly, please reach out to us, and I will provide you an access. And most of you already familiar about how Google Classroom is working, but I will just give you a very small demo about this, the how Google Classroom is working. So let me just I'm sharing my screen with you all, and it is just the introductions for your one up there one. Share. And hope you all are able to see my screen, right? So once you enter to this the Google Classrooms, yes, whatever the classes you are able to see all your classes here. Okay, and if you couldn't find your class one and you want to join, yes, we have a link for that one up, and later on I will provide you. Then you also have, this is the class Preksha meditations. If you click those the class one up there one, the very first portions you will see up here one is a stream, or we can say is a stream board, or is an announcement board, where we regularly post announcements and instructions and all other stuff here one, so you can easily find it out. Okay, so this is our live class here, and then after there is also another tab is called a classwork. So in this tab right now, you do not have all those the classes is open for you, but yes, you can see a week 1, week 2. However, we will be proceeding to the particular week. We'll open those the class for you. So your all videos and class materials, instructions, as well as any kind of those the quiz and something is always been up here one into your particular week program here. We definitely have a people tab where you can see your classmates, who are your classmates. And as you are completing your programs, then you can see your grades as well. So this one is a very high level introductions for those the Google Classroom one up. Okay. And anyone has any questions so far now?
Surilji, how did you get to the previous page?
Here one, you will see, right? Okay, so are you able to see my mouse is hovering
Yes,
here?
yes.
So you are seeing, right? The stream.
Yeah.
So all those are the tabs.
The
Stream,
one before
tabs.
this, the one before Preksha.
So before that one, okay, Preksha. So anyway, I have access to so many and I'm opening and showing you my one, but
Right.
this one is a home.
Okay.
Once you click this, the home button one, whatever the Google
Yes,
Classrooms
this
you
one
are,
here.
you are able to see all your Google Classrooms here.
Do
Okay.
we have access to this page?
No. Okay.
Okay.
Only you have access to the pages, those the classes you registered.
Okay.
So right now, if you are registered for this, the Preksha meditations, you have access to this, the Preksha meditation.
Mhm.
And whenever you click on your Preksha meditations class, you will see an announcement board, very front, very first one. Okay. Okay. So now what are the expectations from you all? So we'll go for that part. We have this is a 6-week online program, and we want you a dedications for at least the 6 weeks, because at least that things we can give it to ourselves, right? And we how much time I have to spend, it is just I will say we are demanding only 2 to 3 hours in a week, in a whole week, just 2 to 3 hours, and that much time I think we can easily provide to us one. Our class timing, online class timing is at 10 a.m. to 12 p.m. So it is 2 hour classes every Saturday for the next 6 weeks. Okay, and during those the classes, because just understand this one is now we all are mature and we join, right? So this class is basically an introductory method where we show you some of those the yogas and some Preksha meditation techniques, and we want you to do a practices, because and then practices, it is on your part as a due diligence ones. Please do all those the practices. And I understand even very first times we cannot get it through, right? So whenever you come to this the second class, on that time we will be see how this the time permit. We'll have another sessions just for those the questions and answers, where you can ask our faculties about your issues or any further informations you want, right? Or any kind of those the techniques you couldn't understand, and they will happily to say show you again or say you again how this the technique is been working. So that is an expectations from all of you. Remember, we do not know everyone's medical conditions, so that's why we have a doctors on board as well. But if something is not permittable according to your health issues, please do not try to perform it. Uh, in a yoga, all those the techniques usually work on every kind of those diseases, but it is still, you know your medical conditions better than us. So, and we will be going through this one with this the guidance of doctors as well as the Samniji, who has an immense experience into this the Preksha meditation. Okay, so with this one, I will open to all, and if anyone has any questions after this the class, please reach out to me.
Thank you. Thank you.
Vandami, it's over to you.
Yes. So thank you very much. I'm sharing first of all about the syllabus and also the course material. Just so let me introduce about the Preksha meditation, Preksha therapy, Preksha yoga, and what is the course content we are taking this time for 6 weeks. I have seen that there are several types of pains, and for each pain, we have different yoga packages. So it looks that all the 6 sessions would be best, especially regarding the pain problem, and we will take different separate sessions for all different pains. So this time, first time, we are taking the headache especially. But before going to the headache and the yoga for practicing to remove the headache or to reduce the headache, just to we take some little bit informations, or you can say introduction of Preksha meditation and Preksha therapy, how it can help us to overcome our physical, mental, emotional, and spiritual issues. So as we know that the spirituality and meditation both are interconnected, and these two components are also connected with health. What we say overall health. So just we have to see that why spirituality is involved in this healthcare program. We know that spirituality means to be connected with the inner self. And according to all Indian traditions, this self is pure in itself and it is free of all disease. So it has immense healing power in itself. So in this particular Preksha meditation program and therapy program, we would like to harvest our own inner healing powers, or we want to focus on our own healing system. So this is what we are looking for. And in India, we have these three traditions: Hinduism, Buddhism, and Jainism. You can see all the three traditions have very strong footing into spirituality and meditation. And they are also giving different yogas for different physical, mental, emotional, and spiritual problems or issues. So to achieve the goal, all the three traditions emphasize on practice of meditation, especially, and yoga. And meditation is a powerful means to realize one's own pure, authentic self. And that is the main goal of practicing all these meditation and yogas in all these Indian traditions. But nowadays, people are more concerned about the health, and they are looking for meditation and yoga for their health purpose. So that can also be accepted. So, but yes, we have to understand the in-depth approach of this yoga and meditation traditions. Yoga, which is taken especially in the sense of the physical and breathing exercise, is necessary for a meditator or any person who is having some health issues to get physical health and fitness. Meditator practice this yoga and exercise, especially to sit in meditation for longer period to realize his own inner realities and subtle truths. But those common people who are having some health issues, they are looking for yoga and meditation or breathing exercise for their health purpose. Now I would say something about the meditation. What is meditation in meditation? So here we can see that there are two types of definitions which we find about meditation in different yoga traditions. And the first one, which is known as Chitta Vritti Nirodha Yoga. So in this particular definition, we are finding that meditation is especially practiced for the purpose of concentration of mind. Our mind is so fickle; it doesn't stay at on one subject, or it doesn't what we say concentrate on one subject for longer period. And nowadays we are perceiving that our concentration is so short. We need different thoughts, different ideas, different things in very short period. We are not able to concentrate on one topic for longer period. So to stop diversions of our mind, meditation can help us, and yoga can also help us to make our body more healthy, to stay at one place, to concentrate on particular topic or subject. The second definition which we find especially in Manonushasana, which has been written by Acharya Tulsi in 20th century, he said that ekagre mana sanniveshanam yoga nirodho adhyanam. So in this particular definition, it is said that to concentrate mind on one object for a longer period, we have to practice meditation. Also, to stop physical, vocal, and mental wakefulness, we have to learn about meditation. In hard sense, meditation is meant to develop the power of concentration to to realize one's own pure, authentic self, and that is the highest goal behind these yoga practices or meditational practices. Now we would see that Preksha meditation is not only just a meditation for a spiritual purpose, but it is also for holistic health, or you can say it is a lifestyle in itself. So meditation may appear to different people, uh, different things, because it is a powerful, what is a tool to realize higher goals of life as well as holistic health. There are four components of holistic health in this particular Preksha tradition. One is physical, the other one is mental, the third one is emotional, and the spiritual. We know that meditation and yoga help each bodily cell to be free from toxins and revitalize themselves. It facilitates, they also facilitate digestion. They also make respiration more efficient and improves circulation, blood circulation, and quality of blood. So these different physical benefits can help us to overcome many such diseases which are under our control. The second is the mental health. So meditation proves to be an applied method to train the mind to concentrate. It cleanses and relaxes the mind. It offers a way to treat serious psychosomatic illness without drugs. It is an efficient tool for ending addictions and other such bad habits. It reveals to one the mysteries of his mind by the realization of the real power of the subconscious and unconscious mind. So far as the emotional health is concerned, meditation strengthens conscious reasoning by controlling our aggressive or negative emotions. The strengthening of conscious reasoning controls reactions to environmental conditions, situations, and behaviors of others. Harmonization of the functioning of nerves and endocrine systems result in control and ultimate eradication of psychological distortions. Spiritual health is also very important for us, and for that we have to see that the firm control of the reasoning mind, regulation and transformation of blood chemistry through proper synthesization of neuroendocrine secretions and productions of dispassionate internal vibrations lead one to attain freedom from anguish and infatuation, and to become free from the effects of mental afflictions and torments, and that paves the path of spiritual growth to the aspirant. Now, what is Preksha meditation? So, just to have a brief introduction about Preksha meditation, there is a lot of literature on Preksha meditation to go into detail about its own meditational practices. But since we have limited time, we are taking just an overview of Preksha meditation, and we know that this meditation is given by Acharya Mahapragya, who was the great yogi and saint philosopher of Jain tradition of 21st, 20th, and 21st century. He has read out all the Jain scriptures, philosophical texts, yoga texts, and also other yoga traditions, and has presented a very holistic, scientific, spiritual technique of meditation in the name of Preksha meditation. So it is propounded by His Holiness Acharya Mahapragya in 1975. Preksha meditation is a Jain practice of meditation which is focused on inner transformation and self-realization. The term Preksha comes from the Prakrit word Peha, meaning to observe, or to perceive without liking and disliking. So we know that liking and disliking or attachment, aversion, or aggressive emotions, they are responsible for distorting the realities of our perception. So this Preksha term stands for pure perception. When the experience is contaminated netted with pleasure and pain or liking and disliking, perception loses its primary position. We could not come to know the real cause of our pains or health issues or our mental and disorders or dispositions. Preksha meditation has been proven to decrease emotional or psychological distress. Various aspects of Preksha meditation are being applied to Western forms of psychological therapy. There are multiple ways to practice Preksha meditation, but the focus of all the practices is acceptance and understanding of our own authentic self and to awaken our own, to activate our own healing system, which is working from within. So bypass is it is not required to say much more about. Just I am coming to the Preksha yoga and therapy. So in this age of technology, industrialization, and over urbanization, we are constantly subjected to tremendous stresses and tensions. These in turn produce psychosomatic diseases like hypertension, insomnia, and various types of heart troubles, including different types of pains also. So in desperation, people start drinking and taking dangerous drugs, which give temporary relief but create more serious problems. The remedy does not lie in drugs or fantasy, but in the process of catharsis and development of inherent powers. So this is what the Preksha meditation and therapy is looking for, that how we can focus on this catharsis process and also on the development of the inherent powers. Today, eminent doctors, specialists, and general practitioners alike have realized that meditation is a powerful therapy both for healing and maintaining good health. Irrefutable scientific proofs are available to show that meditation and consciously achieved total relaxation can cure and prevent any number of diseases which are caused by tension and stress. But still, we have to take this meditation and yoga as a complementary therapy, and there can be other therapies which can help us to come out of those problems and issues which one is having. So meditation and yoga also boost immune system to fight with the environmental pollution and viruses. Improvement of physical health or cure and prevention of serious illness without injurious drugs, though a valuable contribution, is not the only or even the chief objective of meditation. Meditation is, in fact, an apparatus for controlling one's irrational instincts of anger, aggression, cruelty, vindictiveness, and fear, which are the main causes sometimes of different physical issues or illness. It is a process of remedying inner incompleteness and reducing inner discord, as aptly said by William James. Thus, the main objective of meditation is not to acquire physical goodness only, but to acquire total psychical goodness by eradicating all evil from one's thought, speech, and action. So, what are the methods of Preksha meditation to dealing with these all health issues, whether it is physical, mental, emotional, or spiritual? So, we can see that the different methods of Preksha meditation include techniques of meditation, various types of meditational techniques, yoga exercise, physical breathing exercise, hand postures, and mantra meditation. All these methods are aimed to bring transformation in our inner consciousness by hitting on the root cause of illness. There are 12 components of Preksha meditation. Among them, 4 are supportive and 8 are main techniques of meditation. So the supportive techniques, they are mainly used for treating any health issues in this particular Preksha therapy program. And these 4 supportive techniques are asana, that is the physical exercise, pranayam, the breathing exercise, dhwani, mantra meditation, or you can say sound therapy, and the last one is the mudras, that is the hand postures. And there are certain meditations which have also been suggested, and some contemplations for healing different physical problems or issues. So, among those main techniques, we find that the first technique is known as Vichar Preksha. Since the mind is roaming here and there is so much fickleness of our mind, and which is making our mind unrest and thereby creating so many health issues. So, Vichar Preksha is a simple technique to concentrate your mind and to come out of the fickleness of mind. The next is Kaya Utsarga relaxation, that is with self awareness. It is not a savasana as it is taught in some other different meditation practices. Here in Preksha meditations, relaxation is done with self awareness, and that is very important for awakening our inner healing system or boosting our inner healing system. Next is Antaryatra, that is the internal trip, which is very important to awaken our vital energy, using that energy for healing different types of problems and even some pains. Shwas Preksha is the perception of breath. Sharir Preksha is perception of the body. Chaitanya Kendra Preksha is a kind of chakra meditation, you can say. And it is also known as psychic center, perception of psychic center. Lesha Dhyan is a perception of psychic colors, how these colors are playing crucial role to get a good health, how we can change our aura and can have better health. Anupreksha and Bhavana, these are the contemplative meditation and auto-suggestions, which can also help us to get rid of many diseases and wrong habits or wrong conceptions. So these are different techniques we will use in our Preksha therapy program. Just today's session is mainly focused on the problem of pain, and there are some various pains and various causes behind it. Okay, so we have already a doctor with us, Dr. Raj. He will explain what are the causes of different pains in our body. But just I would like to say that there are certain pains which are caused because of our wrong lifestyle, or some injury, or wrong dietary habits, wrong style of sitting and sleeping, imbalance of bodily elements, toxins of the body, or sometimes surgeries. So these are the different causes of our pains, and we can treat all these different pains by following yoga package that has been prescribed here as a Preksha therapy for pain. And we have 5 types of such therapies and therapeutic programs for dealing with pain. And there are physical exercise, breathing exercise. You will see in physical exercise for Muktasan, Sarvangasan, Shashankasan. And in breathing exercise, we will see Nadi Shodhan, change of monostril, Shitali and Shitkari breathing exercise. There are certain meditation which we have to follow. So after practicing physical exercise, we will do some meditation. These meditation have been suggested here. So the meditation on bright white color in the center of forehead, contemplation on the affirmation, my headache is going away, my brain muscles and neurons are getting strengthened. And the next meditation is concentration on and reciting of Om mantra. So these different meditation will help us to come out of certain pains. There is one hand posture also which can help us, and that is Apan Mudra. And the last one, which is also very, very important for us, because we know all the diseases, most of the diseases, they are caused because of our wrong dietary habits. And if we have some control on our habit and dietary habits, that can also help us to come out of so many different physical issues. So limiting food, that is very important for health. And under that, we have to avoid unhealthy and spicy food. So this is the yoga package we are giving today to deal with the problem of pain. And we have the yoga master, yoga trainer here, as you have listened to Deshmukh. But before he starts giving some yoga demonstration, I would request Dr. Raj for explaining the problem of pain in our body from medical point of view. So Dr. Raj might be here, and we will
Yes.
take all the questions in the end, just to finishing all these lectures and session, yoga session. So now I would request Dr. Raj to say about pain.
Thank you, Samniji. I'm going to do my best to offer a brief review of pain from how it is that I, as a physician or physicians, think about it. What I really want to emphasize is that pain is very much an individual experience, and every person is different, and what their body is, their medical conditions can really change how we think about pain. So I'm going to make general points, but it's really important to know that for every person it's different, and really talking to a physician or someone who knows your health history and knows your medical problems, all the medicines you're taking, is really, really important. I'm also going to try and keep this as short as I can. So if you guys have questions, please jump in, ask. I'm always happy to answer and discuss those kinds of things. Okay. So I'm going to get started. So I'll begin with, what is pain? So from my perspective, and I think how we think about it in medical training, pain is anything that you or a patient will tell us it is. It's defined by the person experiencing it. I cannot define someone's pain. It's anything unpleasant. It can be sensory. It can be emotional. But it's what people tell us, and it's complex because everyone's experience of pain is different, and how it affects them, their quality of life, how they function with that pain is different. And pain is not just physical, it involves psychological elements, it involves social elements, it involves behavioral elements. So it's important to keep all those things in mind. How do doctors assess pain? So if someone comes to me, how do I think about it? Well, I try to gather information. I try to find out, where is the pain? How did it start? I try to find out qualities of the pain. Is it sharp? Is it aching? Is it constant? Does it come and go? Does it radiate or does it move anywhere? Does anything associated when I get pains? My vision is fuzzy. When I get pains, I feel tingling. When does it happen? Is it in the morning? Does it happen after I've been working for 4 or 5 hours? Is it better in cold? Is it better in hot weather? How severe is it? So all those things help me form an idea of where the pain is, the quality, and can really help me kind of form an initial idea of a diagnosis of what might be happening. Now, in terms of thinking about pain and how the body anatomically sort of perceives pain, we kind of classify pain in two main categories. There's the nociceptive pain and neuropathic. So, and the way to think of this is that, is this pain from a stimuli, or is this pain because there's damage to the nervous system? Okay, so stimuli, nociceptive pain is if your body's reacting something. If I take a needle and I touch it sharply on my hand, that will stimulate the nerve fibers in my hand, and I will have a sharp sensation, and the nerves will transmit that pain in my hand all the way to my brain, and I will perceive that pain. If I have an infection, if I injure my hand, any of those kinds of pains, there's a stimuli, there's something causing that pain, and it's sending that pain to the brain. Now that stimuli can be real, or sometimes it can be something that's irritated or kind of figmenting. But normally there's some kind of stimuli. If it's in the stomach, if I'm very bloated, if I've eaten too much, the body will send a signal, Raj, you've eaten too much, maybe eat a little bit less, and so on. So that's the general type of pain we think about. Now, there's another type of pain that can happen if there's a damage to the nervous system. So commonly, for example, in diabetes, if your sugars are very high, high sugars are bad for the health and they can cause damage to the nervous system. And when it causes damage to the nerves don't work properly and they start getting pain. They start getting burning pain, shooting pain, a lot of time in the legs. And that's not from a stimuli. It's not because something's touching their legs. It's because there's been some damage to the nerves from that disease. And that's known as neuropathic pain. And those pains can sometimes be similar, but the causes are different. And how we try to treat them can be different. All right, so I'm going to do a general review of pain. I was asked to talk about 5 main types of pain, which is dealing with headaches, neck pain, back pain, sciatica, and knee pain. So I will go into each of those a little bit, but I just want to talk about pain in general, how it occurs. So first is that a lot of times people get pain in their joints and they have pops and cracks, and they come to me and say, should I be worried? And the answer is no. Pops and cracks and these kinds of noises that happen when we move our joints when we're standing or sitting or twisting, that's very common. We don't really understand why it happens, but it's not a serious sign. It's nothing dangerous. So if you're just having normal pops and things like that, I wouldn't worry. But if you're having it in pain, if your knee hurts and it hurts every time it pops, that's a problem, right? Then it's worth having that evaluated. How do I know if my pain is serious or not? Well, I woke up, I slept a little bit funny, and maybe my neck is hurting a little bit. Is that serious? Should I be worried? Should I see a doctor? Or maybe if I rest and I take some Tylenol, I'll get better on its own. How do I make that judgment? So common pain, and a lot of times this can happen as we get older, it's usually milder. It can be dull or it can be sharp. It usually starts slowly. It comes and goes. And if you have pain where like if I move my neck more and it hurts a little bit more and I rest, I get better, that's that's usually a safe kind of pain. And if I take a Tylenol or ibuprofen, my pain gets better. Those are common pain symptoms, and that's nothing that I think is seriously to be worried about. The things that I worry about that are red flags that can be things for more dangerous is if you've had a fall or an injury that causes palm pain. If your pain is very severe and it doesn't get better no matter what you do. If you're having fevers or chills, or it suddenly comes on and suddenly goes away. Anything that's so painful that it wakes you up from sleep, something that's getting worse, or something associated with numbness. Like if suddenly you can't feel parts of your hands or your legs, you're having weakness, you can't hold things properly with a grip, or you feel like your knee is weak, those things are concerning. So those are red flags, we call them. If you have anything like that, especially if there's a fall injury, especially if you feel like it's very severe, if it's waking you up from night, or you have like feelings of weakness or nervous symptoms, those are concerns for more serious, and those are things I think it's worth seeing a physician to get evaluated for. Anyone have any questions so far? And you can type questions too. I'll be watching the chat. Okay.
So, can you hear me?
Yes.
Yeah, one question I have is with respect to when I get to sleep, correct? The calf muscles start spinning for some time and then it goes away. So what this pain will be?
That's a good question. So this is, sometimes when people are going to sleep, they may have some pain, and maybe it's in your calves, and then after some time it gets better. So I would say that I wouldn't classify that as a serious pain if it's just a calf pain, and if it gets better as you go to sleep, that's a good sign. Now, that doesn't mean it's not real. We should still treat it, and there's a lot of things that can cause leg pain and calf pain, and I'll come back to that. I would say for a lot of people, it depends if you're hydrating well, like if you are dehydrated, you don't have a lot of electrolytes, that can cause calf pain if you're not stretching your legs. Certainly can cause it. If you're walking a lot, of course, you're going to be more tired at the end of the day. And then if you have other chronic illnesses, that can also cause it. So. What causes pain? We don't always know, but smoking is really bad. So I always tell everyone, please don't smoke. And there's genetics. If some people in your pain have certain types of pains, there's more chance that you can have it. Right. So I'm going to now go into these individual topics. We're going to start with headaches. So headaches is one of the most common types of complaints I see. And there's lots of different types of headaches and the way they're classified. What I'm going to talk about is the most common types of headaches. And so when people come to me with headache symptoms, there's usually a primary headache disorder, meaning it's a true headache, or sometimes that feels like a headache, but it can be something else, like sinus pain. So a lot of times people that have allergies and they have sinus symptoms, as that picture shows, you can get symptoms in the head and behind the eyes, and it can be very painful. But it's actually not a headache, it's a sinus issue, and you have to treat the allergies in the sinus, and that can get better. In terms of actual headaches, the usual type of headaches we tend to see the most are tension, migraine, and cluster headaches. And I'll talk about each one just a little bit. So migraine headaches, I'll start with tension headaches, sorry. So tension headaches are the most common type of headache. They're mild. Usually you get a dull ache, a pressure. You can have it go from the top of the head all the way to the back of the head. And sometimes you can even feel it shooting down to your neck. So tension headaches can kind of be in any location. They tend to be more general, dull aching, usually kind of going to the back. Usually you don't have any vision changes with that. It's just you just feel that area there. Migraine is a little bit different. Classically, migraine symptoms have this visual element where a lot of people they get light sensitivity, where bright lights are painful, loud noises are painful, and many people have an aura where in their vision they start seeing rings or they have vision changes, and that kind of lets them know this headache's going to be coming on. Usually with migraines, it's not both sides; it's usually one side or the other. It's usually throbbing, and it can usually gradually come on over time. And then finally, rebound headaches. So these are headaches a lot of times that if you have tension headaches and you take a lot of caffeine or you use a lot of pain meds, sometimes you can get into this rebound symptoms where you drink a lot of caffeine, you have a lot of chai, you have a lot of things, and then you go a day without drinking anything or you have any caffeine, and you get a headache from that because your body's so used to having the caffeine. So like I see this a lot in a lot of people that have a lot of caffeine in their diet, and if they suddenly stop the caffeine, they can get headaches, and we call that rebound headaches. And usually after 2 or 3 days, if you say stop caffeine, it will get better on its own, but that can be very tricky as well. So those are the kind of general causes of headaches that I tend to see. Does anyone have any questions on that before I go to neck pain?
So, Dr. Raj, I have a question. So,
Yes.
the pain in the back of the head would be a tension one then, right?
It's a good question. So we don't know for sure. These are just general guides. You can have pain in the back of the head. It could be tension. It could be something else. Headaches are one of the hardest things for me as a physician to evaluate because a lot of times I need a lot of details. I need people to keep diaries and see what's happening. But generally, a lot of times if you have headaches that come in the back of the head and you can take some Tylenol, ibuprofen, it gets better. I think that's reasonable. Another thing to keep in mind with headaches is how often they happen. If they happen once or twice a month, that's not concerning to me. But if they're happening once a week or more, that's a lot, and that can cause a lot of impairment, or that's it's just very inconvenient or unpleasant. So if it's happening more than once a week, I definitely try to look into a lot more and see what might be going on.
Gotcha. And the notes to keep are those Socrates method that you initially mentioned, like what causes.
Yes.
Okay, thank you.
Hello, Dr. Raj.
Yes.
You mentioned when someone comes off caffeine, for example, they have chai and coffee. Let's say they reduce the coffee, and after a few days, it's fine. But you mentioned it can also have challenges. I was wondering about that.
Yes. So there are general class of certain types of of drugs or things like caffeine in that class that if you're having a lot of caffeine and you're used to having caffeine every day, and that like from chai or other things, if you suddenly stop it, right, you're used to having 2 cups of chai every morning or one in the morning, one afternoon, you suddenly stop it. Not everyone, but many people might get headaches because their brain and their body is used to having the chai, and suddenly without that, they get a rebound of the headache. And when that happens, that can be quite painful and quite uncomfortable. Now, typically, rebound headaches after 2 or 3 days, your body gets used to not having the caffeine, and you can be okay. Or if you want to have caffeine, if you drink some chai or caffeine again, you'll drink the chai and you'll feel like your headache goes away because it's better. If you want to stop chai, if you want to come off of it and you have this problem with rebound symptoms, the best thing to do is do it gradually. So you want to, reduce from 2 cups to 1 cup, 1 cup to half a cup. And then if you need to know that you are going to have a rebound, so maybe take some Tylenol ibuprofen for 1 or 2 days after you stop the medicines, understanding rebounds are common. And usually by day 3 or 4, you don't have to worry about it and your body should have adjusted. So does that answer your question?
Yeah, no, I got that part, that after a few days it's fine. I thought you meant there's more deeper beyond that. Maybe not.
Yeah, there's a lot more nuance to it. Without I'm hesitant to go into too many details and take up too much time on it, but there is more to that. My general belief is that we're all better off not having caffeine in our diets. Certainly, I understand many of us it helps us get up in the morning, gives us some sense of energy, and that's fine, and it's safe. Um, a lot of it depends on how much you're having. So you can decide, you can see how much caffeine you're actually having in your diet. You can be measuring it. And if you have a cup of chai that's 50 mcgs or micrograms of caffeine, that's very different than having an energy drink which has 300 micrograms of caffeine, which is a much, much higher dose. So I think for many people, if you're having a cup of chai and you're having a lower dose of it, that puts you in a safer range. A lot of the rebound headaches I see tends to be people drinking very, very high amounts of caffeine. So great. Any other questions? Good. So I'm going to transition and talk a little bit about neck pain. So
I was on mute. I'm sorry.
go ahead.
I have a follow-up question. The question is caffeine also associated with concentration? Sometimes when you drink chai, you feel you have better concentration. Is that psychological or is there a physiological association with it?
That's a great question. What I can tell you is that we've done things where we look at, say, students and their performance on exams. Like if you're studying for an exam, you're performing an exam, do people who drink caffeine have better test scores, better outcomes? Because that's a good measure. If it's actually objectively improving your ability to concentrate, I would expect to see a performance improvement. I would expect to see you do better on your test and your exams, right? And when you look at all the data, drinking caffeine doesn't improve test scores at all, whether you do it for high school students, college students, any kind of learner. So for us as individuals, it may help us in the morning. It may help us feel like we're able to concentrate more. It may make our tasks a little bit energy. It gives a sense of boost. But in terms of performance, when you look at it, it's not actually like giving a massive boost how people are performing. How well you do an exam is you can't just drink a cup of coffee and it's going to magically make things better. You still have to do all the other things. Now, there are some medicines out there that genuinely does help improve concentration for individuals that have ADHD, attention hyperset deficit disorder. When we prescribe them specific medicines to help manage that, they take those medicines that does actually improve their concentration because they have a medical problem, and we do actually see improvements in their test scores. And so I feel pretty confident in saying that caffeine can help us feel like we're doing better, but there's no strong data saying that's going to improve performances.
Okay, thank you.
Yes. Great. Any other questions? I'm turning this from a pain conversation to a caffeine one. It's good. Okay,
It's a very touchy
Yeah.
subject because
No,
everybody loves their chai.
Yeah,
And
I
at
think
the
it's
same
good.
time, one of my medical doctor friends has said that chai is really bad for you. So it's a conundrum in itself.
I think I'll have to do another talk just talking about chai, it looks like, and caffeine. But yeah, it'll be a good one to go into depth into. So I'll come back to neck pain. Let's see here. So neck pain is a little bit trickier because when I think about neck pain, there's really two ways that are common causes of it. One is that you have your spine, your neck spine, or we call that cervical spine, and we worry about palms in there. But there's also a lot of muscles in the neck, right? Because your neck has a lot of mobility. You can tilt left and right, turn left and right, up and down. So in order to do all these different motions, have this great flexibility, and then really support your head The neck is a lot of muscles, does a lot of important work, as you can see in this picture there. And so there's a lot of places you can get strains and you can have pain related to the muscles area. So when I think about neck pain, I'm trying to figure out, do I think this is something with the spine or do I think this is more of a muscle issue, right? Um, and when I think about muscle issues that can cause neck pains, a lot of times it does overlap with tension headaches. You can get myofascial pain. So you have, muscles that go from the upper back up through your neck into the back of your head, the occipital area. And that whole area there is a very common area for to have strain, for to have tension headaches, to have fascial neck pain, also to have strain. So, if I sleep the wrong way on the pillow, I can have strain, things of that nature. A whiplash injury, so people in car accidents where suddenly the neck quickly moves forward, causes a lot of issues there in that area. And so those are things that we can manage safely, but a very common cause of it. More concerning the spine, some people can have fractures, and that can happen because of an injury, like a car accident trauma, or that can happen due to arthritis and compression over time. And then you can have disc-related pain and pinching on the discs. And that's more that's more of a
ऐसे करो
spinal issue.
मारो ज्वाइन करो
That's more of a spine issue, and that's a little bit different. We have that. So when I'm looking at the spine, this is just anatomy of the spine. It can get very, very tricky because you have discs there, you have different joints, you have ligaments, you have nerves coming out. So it can be really hard. And if I think someone's having pain in their spine and not their neck, a lot of times we might have to do scans like MRI to kind of sort it out. But the big red flags to look out for here are if you have pain where you have shooting down to your arm, right? And you think it's your neck area, or if you have pain that's sudden, very severe, that's not getting better. A muscle pain, you feel stiffness. Sometimes you move the neck, it gets better or worse. Or if it's the spine, none of those seem to make a difference. That can be a lot more concerning. And so if we think there's anything related to the spine, important to see a doctor, important to have that evaluated to make sure there's nothing severe going on. Whereas the more muscle causes of pain, a lot of times we can manage with things like therapy, rest, anti-inflammatory meds, and time. Is neck pain common? Yes. 2/3 of people get it at some point, 10%. And a lot of this, especially in the muscle area, if stress, if you're reading, a lot of people in education, they don't have good posture. A lot of this is very, very preventable. So, questions on neck pain?
With increased cell phone usage, you see neck pain increasing because of the head is always.
Yeah, so you see that picture there. One of the pictures there is someone holding a cell phone to their neck. And those of you who are older, remember in the old days, you have these phones and you're trying to hold it with your neck and your head. Absolutely, posture is very important. I don't want to just blame cell phones. There's a lot of things that can cause bad posture in modern life, right? And I'm sure there'll be new inventions in the future that will make this worse. So, but yes, posture is important. And whatever devices, whatever you're doing, whatever is involved in your occupation day to day that has you doing repetition activities and a poor posture can definitely contribute to neck pain.
Hello, I was curious about it being associated with higher education.
Yes. So it's association, it's not causal. So I don't want to say that people who are more highly educated have more neck pain. But there is this thing where when you look at the data, a lot of people who have neck pain are people who are in occupations that are higher education type occupations. So people think, oh, I'm a construction worker, or I work labor, I work outdoors, that those are the people that have neck pain. That's actually not the case. A lot of people who are sitting in front of a computer all day are the ones who are coming to me with neck pain, right? And so I think it really suggests that posture and things like that are important when you're considering this.
And that makes sense to me.
Any other questions? Good. So I'm going to discuss back and sciatica, and I put them together because they kind of they're different symptoms, but they tend to kind of be grouped because anatomically they're near each other. So back pain, probably one of the most common things, more than 2/3 of people. Fifth most common reason we see people have it, and it's really highest after the 30s through people in their 60s. So, a common age group. When we think about back pain, we think about when it's acute, meaning it's a short term, usually less than 6 weeks, and then chronic, which is more than 3 months. And they're very, very different causes for why you can have short term back pain that resolves versus this chronic back pain that can be very, very difficult to manage. And then, with back pain, there's a lot of causes with it. Stress, people who are physically working a lot, who are outdoors, manual labor work, you see a lot more back pain. Also, people who are very sedentary, not getting enough exercise, you'll see that a lot. A lot of psychological elements to this as well. I mean, people who have anxiety and depression, a lot more issues with back pain as well. Very, very challenging problem. What are the causes of it? Similar to neck pain, you have muscle issues. You can have a sprain in the lower back muscles. You don't have as many muscles in the lower back as you do with the neck because the mobility is a little bit different, but it's very common that can happen. If I'm at the gym and I'm not lifting weights carefully, I can pull a muscle there. But the bigger concern was really about is the spine, and the spine is a complex structure. There's a lot of different elements to the spine, and depending on where in the spine exactly you're having a problem, we have all kinds of different medical terms. So you can hear about disc bulges, you can have spine arthritis, you have spine stenosis. They're all technically a little bit different, but the general idea here is that there's a problem from the spine, and that is causing pain, and that pain is at the point where you have at the point of the problem. So if I have a fracture or if I have a stress or stenosis or arthritis at L3, L4, I will have a pain exactly in that spot. Right? I'm going to have the pain in my back, generally where that injury is. Okay. Sciatica is different. Sciatica is not really even a diagnosis, it's more of a symptom. And what it is that there's this nerve that goes down the leg. And I'm gonna shoot forward here. This is the nerve here. And what it does is that it basically helps control our leg for our leg movement, and it comes down from the lower aspect of the spine. And anything that pinches on those nerves will cause a shooting pain. And sometimes that pinching can occur when the nerves are coming out of the spine. Sometimes it can happen in the pelvis. Sometimes it can happen lower in the thigh area. So there's a lot of reasons you can get shooting pain here, but sciatica is more of pinching on this sciatic nerve that gives the nerves movement and control over the leg. Whereas back pain and spine pain is we're thinking more about the spine and the back directly itself. Okay, so when I think about low back pain, what are the most common causes? So the first is non-mechanical, meaning these are things where it's not the spine, right? If it's not the spine, it's a lot of times it's the muscles in the back. If we're lifting heavy things and we don't have good posture, if we fall on our back, if we have Paul sitting, we're bending forward, looking at our phones too much, or if we get arthritis, those are things that can all cause pain in the lower back. And those are all things that really should be managed non-surgically. A lot of ways that those are reversible and manageable. And so really, really causing. You can also have some kidney stones, although it's a less common cause of back pain as well. Okay. And then you have like the more serious causes of back pain. So then when I worry about things like very severe arthritis, infections, cancer, things of that nature, and just like with neck pain, if you're having very severe symptoms that aren't getting better, definitely a red flag, definitely needs to have evaluated. I heard this term a lot. People ask, "What is it?" Does someone have a question? I get asked a lot. I get asked a lot about a herniated disc. What is a herniated disc? So this is a normal disc that we see in the top here. And a herniated disc is when that disc breaks, and herniated is just a Latin term for meaning pushing. So it pushes out and can cause pain because it starts pinching on the spine and the nerve. So it's out of place. What's interesting is that when we do imaging studies, like if I do an MRI or CT scan of the back, you will find a lot of people that have these mild herniated discs, but they don't actually cause symptoms. So it's not always a bad thing. Most people with these don't necessarily have symptoms, but sometimes they do, and it can cause problems and may need surgery. So, and then sciatica, what causes sciatica? So the main thing is that it's a symptom, and you can have usually a lot of different causes from it. Is either from the spine area, if something's pinching on the nerve, or it can be outside the spine if pinching is occurring in the pelvis or different areas down the leg and the thigh. And there are different muscles and syndromes that can kind of cause this. And a lot of sciatica can really do a lot better after therapy, stretching exercises, because once you strengthen the muscles, reduce any inflammation or things that are pinching on that nerve, it can really get better in a lot of patients. Okay. And so these are just common examples of different causes of sciatica. And that's it. Any questions on back pain or sciatica before I move on?
Can you cover more about osteoporosis?
Yes. So osteoporosis is a medical term, and what it basically means is that our bones are made strong because they have a lot of calcium and vitamin D that give it strength and help it stay mineralized and strong. But as people get older, the bones get weaker. And as they get weaker, rather than being very strong, they kind of lose a lot of their strength and they can actually start getting shorter, compressing, and reducing in size. So think of it almost as something that's a sponge that's very hard, and now you make it wet, and now you can squish it a little bit, right? And so when you have osteoporosis, because the bones are weaker, you're more likely to have fractures. So people can sometimes get hip fractures or arm fractures or things like that. Now, the spine is a very interesting joint. It's not like the elbow or the knee where it's moving and you're going to fracture a spot. The spine is like a column. And so when you have osteoporosis in the spine kind of shrinks. And as it does so, it can start causing a lot of these diseases where you have arthritis, stenosis, herniations because of that. And the main goal with people who have osteoporosis, especially women and older individuals, is to try and catch it and treat it before it gets severe and before you start having a lot of damage to your bones and you start having these symptoms. Great. Any other questions or any follow-ups?
So what's the treatment there?
Sorry, what was that?
What's the treatment for osteoporosis then?
Right. So there are medicines that we use to treat osteoporosis, usually a class called bisphosphonates to help make the bone stronger again. And that's usually what I prescribe to my patients, and I can convince them to take it.
Sorry, what medicine you prescribe?
There are many medicines. The most common ones are bisphosphonates, like fosamax, alendronate, things like that.
Got it.
Good.
May I ask a question, please?
Yes, of course.
I wanted to, since we're talking about pain, what about dental pain? You know,
Yes.
for example, it travels up the face and sometime into the eye.
Yeah, so
Would that?
very important. So that's a great point. So, I was talking earlier about headaches and neck
Correct.
pain, but a lot of times pain can be referred from other parts of the body. So I mentioned sinus issues and sometimes people with allergies and sinus. That can cause symptoms that feel like headaches. So dental pain is another big problem because you can have dental infections, you can have cavities, you can have tooth-related pain, and rather than causing you pain in your teeth, it may cause you pain that shoots up to the back of the head, down below, and other areas. So very important to address if you have dental issues, and very important to treat. And that's one that is treatable and reversible. So that's an important one to identify. Absolutely.
So that pain, if it's traveling to your eye, is not the same as the cluster, because in your the illustration, the fourth one was a cluster and the eye was
Yes.
highlighted.
So I
It's
didn't.
not. It
That's
is.
It's a great question. So if you have dental pain, let's say, and causing you eye symptoms, how do I, as a doctor, know is that from the dental pain or could I be having a cluster headache? It can actually be very difficult to tease this apart. What I generally say is that if you have an obvious explanation for your pain, if you know you have a dental problem, I'll say let's treat that first and see if your symptoms get better. Because if you treat the dental issue and everything gets better, then I can say, okay, that was the dental pain. But if we treat the dental issue and you're still having symptoms that may be a cluster headache type symptom, then I feel like maybe we need to work that up next. So a lot of times you won't know the answer just based on an evaluation or an imaging scan. Sometimes you have to start doing treatments to kind of figure out what's happening. And it can take time. It may not just be one visit. It might take a while before you can figure these things out.
Okay.
Right.
Thank you very much for
Yes, of course.
taking my question.
Yeah. Any other questions?
Thank you, Dr. Raj,
Okay.
for your very inclusive And we can see very informative talk regarding different pains and their causes. And you have also suggested we can be more careful about all these different pains and can come to know the real cause in our body for our various different pains. So thank you for coming and giving so informative, very lucid lecture. And if the participants have some other problems, they will come with their own questions. So it is good. Now we have a yoga session, since it is a practical course, and we have to practice some yoga, physical exercise, breathing exercise, hand postures, and meditation and mantra therapy, or you can say sound therapy, for reducing our pains or sometimes removing pain, coming out of this pain. So I would request Krishna Deshmukh for giving physical exercise, breathing exercise. He will demonstrate each exercise first and then instruct you to do the same. So please open your videos, take the yoga mat to follow the instruction for particular physical exercise and breathing exercise and the hand postures. So he can check that you are following properly or doing properly. Okay. So it would be better if you have yoga mat, please take that and sit on that. And first he will show how Pavan Muktasan is done, Sarvangasana is done, and Shashankasana is done. So he will start with Shashankasana first, and then Pavan Muktasan, and then Sarvangasana.
Right. Thank you, Sanniji. Now we have already learned about pain. We know the reasons of pain. And Acharya Mahapragya has given a treatment through Preksha Dhyan. Basically, here he has suggested some asanas. Then there is pranayam, preksha, anupreksha, that is contemplation. Then jap, what jap to be done. Then tap and postures, and postures. As Samaniji has told you, that first we will start with Shashankasana, then with Pavanamuktasana and Sarvangasana. These are the three asanas which are recommended for the relief of headache. And not only that about headache, but that gives relief in other ways too. So first we will go for Shashankasana. Shashankasana, Shashank means rabbit. So Shashank, that is rabbit pose. So we'll go for Shashankasana. To perform Shashankasana, you have to come into a posture that is Vajrasana. So while practicing Vajrasana, so when you do any asana, first of all, you do it as per your capacity. Don't stress or stretch more. Whatever possible that you do. Don't go to the perfection immediately. Once you start practicing gradually, you will become a perfect. So first let us select the position. So for doing Shashankasana, we have to sit in Vajrasana. Vajrasana, first open your both the legs. And always before doing any asana or any postures, you have to do some warm-up also. Now we will not be doing warm-up because I presume that you have already started activities, so you are warmed up. So for Shashankasana, first you come to Vajrasana, fold your right leg, let the heel go behind your buttocks, then shift your weight on the right leg, fold your left leg. Now you are in a position that is Vajrasana. I hope you are able to see me. So this is the pose of or posture of Vajrasana. Now both the legs are parallel or they are touching the ground. Both hands on thighs. So this is the posture which is Vajrasana. And this is the only asana which you can do after meal also. Rest, other asanas, they should be done empty stomach. So while doing Shashankasana, first come in this Namaste Mudra or Namaskar Mudra. And while breathing in, take your hands up. both the arms are touching your ears. Stretch is upward. And now, while breathing out, bend in the waist region, not in the back. Waist region, go gradually forward. Stretch your body from the. Try to touch your forehead to the ground. Normal breathing. Stay for some time. Experience the stress or stretch in the body. While breathing in, come to the original position again. Up. While breathing out, bring your hands back to the thighs. So this is how it's Shashankasana. So we come to the posture of a rabbit. I will do it once again. Both the hands are folded. Then while breathing in, let your hand goes upward. Give a stretch. While exhaling, bend forward. Touch your forehead to the ground. Experience the stress in the body. Normal breathing. While breathing in, up. While breathing out, bring the hands back to your thighs. Now I feel that you have observed me. Are you able to do it? Or I can once again give instruction, you can do it at your place. So I request all of you to do this Shashankasana. So club your hands like this in the Namaste Mudra. While breathing in, stretch it upward. Give a stretch. While breathing out, bend forward. Try to touch your forehead to the ground. Normal breathing. While breathing in, raise your hands up. While exhaling, hands on the thighs. So this is how is done Shashankasana. Now Shashankasana, what happens when you bend down, the blood supply goes to your head or to the brain. So you get more oxygen or brain gets oxygen, and that's how your headache can be reduced. This is one part of it. So if you have any query about this, or are you sure, can you do it? Or if somebody wants to have any difficulty, they can show me how they are doing. Otherwise, we'll proceed to the next asanas. We have done now.
देशमुख जी नमस्कार
Yeah.
मेरी दोनों knees replaced हुई है तो how can I do the Shashankasana? I cannot sit in Vajrasana.
In that case, you cannot sit in a Vajrasana because your knees are paining, so you cannot sit in a Vajrasana. But you can sit in a chair and you can do this like this. Breathe in, stretch your hands upward, and try to bend as much as possible in the chair only. And while breathing in, you can once again come back to the normal position and bring your hands out. That's what you can do. But okay, don't try to sit in Vajrasana because that will damage your knees further.
Yeah.
Okay.
Thank you.
Now we'll go for Pavana Muktasana.
Okay. So Deshmukh, Ronak Parikh wants to know something. You can ask the question.
Yeah. Mr. Deshmukh, so when you're going down, you might initially we won't be able to do all the way down, right? But over time, we'll be able to touch our head to the floor.
Yeah, as I said in earlier, no, you do it as per your capacity because it may not be possible for everyone to do this perfectly. But once we start doing it and with the practice, we can become perfect over a period of time. Initially, you may not have that complete benefit of the asana, but when you do it regularly, then there will be perfection and you will see the results also immediately.
Thank you.
So we will go for Pavana Muktasan. So Pavan Muktasan is in two parts. One is Ardha Pavan Muktasan, then Purna Pavan Muktasan. So initially we will be doing half, then it will be complete Pavan Muktasan. So for Pavan Muktasan, you have to lie down on your back in a supine position. I will show you how it is done. Both the feet together, both the hands near your thighs, the palms touching the ground. First, breathe in, lift your right leg 2 inches up or 4 inches up, then take it to the right. While breathing out, make your leg straight, then fold the leg, hold it with both the hands or lock it with the hands. While breathing out, lift your neck and try to touch your knee up. Stay for some time. While breathing in, bring your neck to normal. While breathing out, straight your leg and slowly down. Then relax. So this we have done with right leg. The same thing you have to do with left leg also. Again, you have to be ready again with the same position. Lift your left leg just 4 inches up. Breathe in. Take your left leg to left side. While breathing out, bring it together or near. While breathing in, fold your leg. Lock with your hands. While breathing out, lift your neck up and try to touch your nose to the knee. Up. While breathing in, take your neck to the normal or the floor. While breathing out, straighten your leg slowly down. Relax. So this we have learned about Ardha Pavan Muktasan. That is half a Pavan Muktasan. Now I will show you Purna Pavan Muktasan. How to do it completely with both the legs. So again, ready? Bring your both the legs together, both the palms touching the ground. While breathing in, lift both the legs 4 inches up. Take it to right side. While breathing out, make it straight. Hold both the legs. Lock with your both hands. While breathing out, lift your neck up and try to put your nose between the knees. Up. While breathing in, take your back or your neck to the ground. While breathing out, straighten your legs slowly down and relax. When I say relax, you have to keep both the legs apart, 1 to 1.5 feet. Both the hands 6 inches away from the body. The palms are facing upward. Same thing you can do the other side. You can do it in one stroke or you can take a break and do it. Again, while breathing in, both the legs 4 inches up. Take it to the left side. While breathing out, straighten your legs. While breathing in, fold your legs. Lock both the legs with your hands. While breathing out, lift your neck and put your nose between the knees. Up. While breathing in, bring your neck back to the floor. While breathing out, straighten your legs slowly down. Relax. Keep breathing. So this is Pavan Muktasan. We have done in 2 phases. One is half, that is Ardha Pavan Muktasan, and another is complete Pavan Muktasan. So here what happens? Your legs become stronger, your hands become stronger. There is a massage to your stomach also. And those who are having regular complaint of gas, they can be relieved of gas by doing this asana regularly. So we have seen two, that is Shashankasana and Pavanmuktasana. Shall I go to next asana now? Sarvangasana?
So one question for
Yeah, please.
the Ardha one is the beginner one, correct?
Pardon?
The Ardha one, the half one, is how the beginner should start. And then
No, these are the Pavanmuktasana is in two steps.
oh, it
One,
isn't.
we do it half, that is with one single leg. Then one do it with both the legs. Now doing with both the legs is little difficult. So it doesn't matter if your nose doesn't go to the knees, you can stay behind. Gradually it will go, because if there is no flexibility in the body, it will be difficult. So when you do it regularly, the flexibility will be achieved or attained, and then you can do it perfectly.
So first step is the one leg, and then second step is both legs.
Yeah, first with one leg, then with second leg, and then with both the legs.
Both legs. Okay.
So you can go forward gradually. There is no need to stretch yourself.
Yep.
Go gradually and do it as per your capacity one.
Yep. Thank you.
Okay. Now the third asana is Sarvangasana. The name itself suggests that it is for the complete body. And Sarvangasana gives you all the benefits of Shirshasana. So here only you are not directly head standing, but you are lifting your body up. So I will tell step by step. Now we'll be performing Sarvangasana. Again, both the legs together, both the hands near the thighs, palms touching to the ground. While breathing in, lift your legs to 90 degrees. While breathing in, both the legs 90 degrees. Up. Breathe out. Once again, breathe in and take your legs little behind and support your waist with your hands. So take it behind, breathe in, support the waist region and lift your body up. And now you have to touch your chin to the larynx. If you have cervical pain, don't do that. You have to keep your body straight. Now normal breathing. There is no need to hold the breath. Still some time. Then breathe in again. Kick your legs backward. Bring your hands down. And slowly come to the 90 degree by touching every vertebra to the ground. Slowly. Breathe out completely. Breathe in and slowly down. Then relax. This is Sarvangasana. I'll do it once again. While breathing, both the legs 90 degree up. Breathe out. Breathe in once again. Take both the legs backward. Support your back with hands. Make your body straight. Touch your chin to the larynx. Normal breathing. Stay for some time. Then breathe in once again. Kick your legs backward. Put your hands to the ground. And slowly, with every vertebra touching the ground, come to 90 degree. Breathe out completely. Breathe in, slowly down. And relax. Keep breathing. And while coming to the normalcy, you have to take a left side turn and you can sit once. So this is Sarvangasana. Sarvangasana is one of the best asana. If you do it regularly, that relieves your back pain also. There is more blood supply to brain. So that will also helpful for the brain. Brain gets more oxygen. Legs become strong. Your spine is also becomes flexible. Because for good health, spine health is important. If your spine is healthy, then your health is good. So these are the 3 asanas. So if there is any query about Sarvangasana, Sarvangasana improves your vision also. Any question?
Yes,
So
I
these
have,
are the
I have a
asanas.
question.
Yeah, please.
How many times should we do each of these asanas?
See, if you are a beginner, don't do it for a longer time. If you are beginner, just stay for 10 seconds also. And as you practice more, you can increase your time for that. For Shashankasana or for Pavan Muktasana, even for Sarvangasana. After doing Sarvangasana, you have to do Matsyasana. But that is not there in this. So when next time we are other disease, we can do it. So that is the Viparit Asana for Sarvangasana. So this duration you can increase gradually. Don't do it at a stage for the first time. Do it as per your capacity. Because for some, it may not be possible to do the Sarvangasana immediately or in the first instance.
Okay.
So
And,
keep your, while keeping your ability in mind, do the every asana.
okay. And should we do each asana twice or 3 times?
Initially, I will suggest do it only once.
Once. Okay.
Because it will require more energy. Because I wanted to show you, so I did it twice. But you can then gradually increase the time. You can do it once only. And what is important, we have to lead to perfection. If you are doing correctly, then you will get better benefits or more benefits.
Okay. Okay. Thank you.
Okay. So for headache, these are the 3 asanas recommended by Acharya Mahaprabhu. So these 3 we can do, practice regularly. I suggest you can practice today, and while practicing the asana, make sure that you are empty stomach. So this is one asana we have done. Pranayam is Nadi Shodhan. So while doing Nadi Shodhan, you have to sit either in Vajrasana or Padmasana or Ardha Padmasana or Sukhasana, whatever is comfortable, convenient to you. If you cannot sit down, you can sit in the chair also. So this is, I am sitting is in Ardha Padmasana. This is Sukhasana. Padmasana will be a little difficult, so immediately you may not be able to do it. So either of these asana you can choose. So you can choose Padmasana, Vajrasana, Ardha Padmasana or Sukhasana. And Nadi Shodhan is sort of a Anulom Vilom Pranayam. So while doing Nadi Shodhan, keep your left hand in Jnana Mudra or knowledge posture, your thumb on right nostril. You can fold like this, thumb on right nostril, 2 fingers folded, and the remaining fingers on left nostril. So you have to close right nostril, gradually breathe in with left nostril. Hold it for some time. That is 1, 2, 3, 4, 5. Then close left and breathe out by right. Then hold it outside. 1, 2, 3, 4, 5. Then breathe in from right. Hold it for some time. Then breathe out from left. Hold it outside. 1, 2, 3, 4, 5. Then breathe in from left. Hold it inside. 1, 2, 3, 4, 5. Breathe out from right. Hold it outside. 1, 2, 3, 4, 5. Breathe in from right. Hold it. 1, 2, 3, 4, 5. Then breathe out from left. Relax. So from where we started, we have to end on the same nostril. So this is how we can do it initially for 3 minutes or so. So this is Nadi Shodhan. So what we are doing, we are taking breathing or breathing in, inhaling, holding the breath for some time, then exhaling. Then again, inhaling from the same side. So every time when the breath is out, you are holding for some time. When the breath is in, you are holding for some time. By doing this, it is called kumbha or holding the breath. So by doing this, what happens? Your body gets more of oxygen and carbon dioxide comes out completely out. So you get more energy because if we are not breathing properly, so if you do this Nadi Shodhan, gradually oxygen level will be increased and we'll be taking use of our lungs completely. Because the capacity of our lungs is 5 to 6 liters. We take half liter of a breath. So there is residual volume will be around 3 to 3.5 liter inside. So you should take at least 2 to 2.5 liter in one breath. But that is not happening. And one more thing, that this is the only system which is in our control and not in control. So it runs automatically, but if I ask you to take deep breath, so it comes in your control. So we can make this practice whenever you are free. If you have some 2-3 minutes time, you can practice deep breathing. Taking gradual breathe in, hold it for some time, gradually breathe out. The breathing out time should be double the time of breathing in. In that case, carbon dioxide is completely out and oxygen you get in more quantity. Then comes, this is one. So if you have any query about this or any doubt?
Yes, sir. I have a question about Nadi Shodhan and Kumbhak and Rechak. For how long period we should do Nadi Shodhan pranayam or Anulom Vilom? Can we do like 5 minutes or 15 or max? What is the maximum time limit?
See, I will suggest, if you are not used to it, I will suggest initially do it less. You can do it 5 circuits, that is 5 rounds or 7 rounds. But once you are practicing, because gradually the ideal is 9. You have to do it 9 circles.
Okay.
So you can do initially in the morning, then you can do in afternoon also, and you can do it before sleeping also. So total it will be 27 in a daytime. But start with initially 5, 7, then 9. Gradually you can increase. So this we have seen now. Nadi Shodhan we have done. Then comes any question?
Yes. What should be the ideal frequency for Kumbhak and Rechak?
Ideal frequency for
Kumbhak and Rechak, like
Kumbhak
holding
and
the
Rechak.
breath in and out.
Yes, Kumbhak and Rechak as per your capacity. Because see, I may hold my breath for 10 seconds or 15 seconds. But if you are not used to it, then you will become restless. So don't be restless. Do it as per your capacity. Hold it initially for 5 seconds. Once you do it for 5 seconds, you can hold for 10 seconds also. And if you are having blood pressure or cardiac problem, no need to hold the breath. The patients with cardiac problem or hypertension should not hold the breath. And those who doesn't have this problem, they can gradually increase the time. But don't overdo it, because that will cause you restlessness and it may have a damages also. So that we should not do. We do it as per our capacity only. So initially, take a deep breath, hold it 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then breathe out. Hold it outside. 1, 2, 3, 4, 5. Then breathe in. Again hold for 10. So when you hold for 10, that becomes 5 seconds. When you hold for 5, that becomes 2.5 seconds. Gradually you can increase the time. And if you have any element of heart or blood pressure, etc., don't hold this breath. Then you can just breathe in, breathe out. Breathe in, breathe out. That you can do. That is Anulom Vilom.
Will it increase the body heat?
It will increase your capacity of lung actually. When you take a deep breathing, it increases the capacity of lung. As I told you, the capacity of lung is 5 to 6 liters. But we are not using it completely. Especially those who are smoking, their breathing in time is very less, or they breathe in very less quantity of oxygen. Because in air, there is only 10%, 20% oxygen. So if you take half liter of breath, you are getting only 10 ml of oxygen. And then you are breathing out. Out of 10 ml, maybe only 3 to 4 ml will go inside your blood. So when you start deep breathing, the more oxygen goes to your body. So automatically your brain gets more oxygen, each and every cell of body gets more oxygen, and your body becomes healthy. So if you want to have a better health, you can do this practice regularly. Take a deep breathing, breathe out completely. So that will increase the stamina, increase your hemoglobin also, or oxygen carrying capacity. That will help the body.
Thank you.
Yeah. So now next is our swara parivartan. Now these are two swar. One is left, one is right. Left we call it as Chandra Nadi, or you can call it as a moon system, or right side is Surya Nadi, or it is in English we call it as a parasympathetic and sympathetic. Sympathetic gives you energy, parasympathetic that reduces the stress or brings it to normal. So when we do swara parivartan, that is swara means this left swar and right swar, swara parivartan. So what you have to do? You have to breathe in completely with left, breathe out with left, breathe in, breathe out, breathe in, breathe out, breathe in, breathe out. So this you can do up to 3 minutes. Then now close your left, breathe in with right, breathe out, breathe in, breathe out, breathe in, breathe out. This is how you can do swara parivartan. So what is happening when you are taking breath with left and leaving with left? So your body becomes cool. When you breathe in with right, breathe out with right, your body becomes hot. So in this swara parivartan, so you are calming down your body, you are activating your body. So you are activating and calming down. So what we are doing here, we are maintaining the balance between sympathetic nervous system and parasympathetic nervous system. That is how it works. So that balances our nadi. So when we do it regularly, then the third nadi, that is sushumna, that gets activated. So while somebody was telling, you have come down to one word was there, that is antaryatra, or we call it as the internal trip. So when you do that internal trip, your sushumna also get activated. But we are not on that topic, so we're not going deep into it. But just as an information, I told you about it. So this is, we have seen Nadi Shodhan, then Swara Parivartan, and then there will be two pranayam, Shitali and Shitakari. But Shitali and Shitakari, when it is hot weather, that time you should do. In cold, don't do it. While Shitali, you have to bring out or take out your lung little out, turn it or like a pipe, breathe in with the tongue, from the tongue inside. So first you take out the tongue outside, breathe in, then hold it for some time and breathe out with nose, like this. When you do it 5-6 times, automatically you will feel coolness in the body. So when it is hot outside, if you do this pranayam, your body temperature goes down. And when your body temperature goes down, if you have a difficulty or headache is there, that also will be relieved. But don't do this practice in cold season or in cold, because already there is cold, body temperature is low, and if you further lower it down, so it will cause you cold or other cold or maybe rhinitis, etc. So this is Shitali pranayam. Then other is Shitakari. While doing Shitakari, you have to put your tongue between your teeth, gently, like this, and then breathe in through the holes of your teeth, touching the tongue. So when the air goes inside, that becomes cool. And you have to breathe out through nose like this. So this is Shitakari. But this is to be done only in hot season or in summer. In winter, don't do it. That will reduce the temperature further down. So any query about this, Shitali or Shitakari? You can practice it regularly, especially in hot season. And in cold also, if you're doing, don't do it for a long time. In summer, you can do it for more time. So these are the pranayam suggested for headache. Nadi Shodhan, Swara Parivartan, then Shitali and Shitakari pranayam. So that brings down your body temperature, and Nadi Shodhan and Swara Parivartan balances both the, that is sympathetic and parasympathetic system. Then there is a Preksha for headache. What Preksha is?
So yeah, that meditation I will give, and just you can finish with a hand posture, that is Apan Mudra. So you can show how it is done.
Okay. Any question?
Okay, so just you can show the hand posture of Apan Mudra.
Oh, Apan Mudra, okay. If there is no question, we'll go to Apan Mudra. Apan, the name, I will first explain the name, Apan Mudra, because we have 5 prans in the body. So that one is Apan, then Udan, Saman, Pran, and Van. Van is throughout the body. So these are 5. Apan is below your navel. Apan. So when there is a disturbance in your gastric or alimentary canal, the Apan gas is increased. So Apan Mudra, so what you have to do is between 2 fingers, that is middle finger and the next finger. So hold these 2 fingers and touch it to thumb. And this last finger and tarjani, the first finger, they should be open. So this is Apana Mudra. So for headache, you can do this Apana Mudra. So you have to hold it like this and breathe slowly inside and breathe out slowly. So when you are doing these mudras, as per the science, it tells that it should be done for 45 minutes, but not necessary. As per your requirement, you can do it for 5 minutes, 10 minutes, as per your requirement. That will reduce the headache. This is Apana Mudra. So name is come from the Apan Pran. So Apan Pran is below the navel. So that is Apan. So this is Apan Mudra. So that relieves the Apan, or when there is gas, etc., that is taken care of, or this is further increasing the Pran in the body. That is Pran, I told 5, Apan, Saman, Udan, Pran, and Van. So these 5 prans are there. So this is helping the pran. So this is Apana Mudra. Then there is a Prana Mudra, Alag Mudra, that will come as per the other diseases we perform. So this is Apana Mudra. You can do it regularly for headache, if you have headache. So we have seen Asan, we have seen Pranayam, even Shitali, Shitkari, and Mudra. So these are the 3 things. Then there will be Preksha. So you have to, what Preksha you have to do for headache? You have to concentrate on your Jyoti Kendra, or on the forehead, in the middle of the forehead. There you have to meditate with white color. So you have to see the white color. You have to imagine that white molecules are spreading on the lalat, and it is bright white color. And if you do that, then that also reduces, because here it comes to pituitary and pineal. So that improves your mood, and the headache will be reduced. And then there is contemplation or anupreksha. So there you have anupreksha. Here I have in Hindi, actually it will be, so मस्तिष्क की स्वस्थता का सुझाव, that is मेरे सिर की वेदना शांत हो रही है, मस्तिष्क के स्नायु शक्तिशाली हो रहे हैं. That means my headache is relieved and the nerves of my brain are becoming stronger. So this you have to contemplate. Initially, you can do it verbally, then gradually you can do it, or then you have to do it mentally. So you can do it for 15 minutes. That also reduce the headache. And the last jap is of Om. So you have to do Om. Om is take a deep breath, sit in a Sukhasan, Padmasan, Vajrasan, or Ardha Padmasan. Take a deep breath. Again, breathe in. So breathe deeply and slowly, gradually, you can have that Om Uchchar. You can do it 5 times, 7 times, 9 times as per your time available. And lastly, what is important, you should not eat fried things. Don't use spicy material or spicy food. That also gives you headache. And another is when you have stress that or tanav, tension, that also gives you headache. So when you practice all this, which have been suggested by Acharya Mahapragya, that is asana, pranayam, preksha, contemplation, jap, that is om, and food habits, that is also important. Because these are not the disease, or headache is not a disease. There is no bacterial infection. But it is maybe because of lifestyle also. So if it is lifestyle, this will certainly help and you can be relieved of headache. Any query, any question? Because we are nearing our time.
Hello, G. The first one you showed, we're just holding the hand in that mudra position. I forgot the name, and we're just normally breathing in and out through the nose.
I couldn't get you. You are talking about Apana Mudra?
Yes, yes.
Apana Mudra, this is Mudra. Actually, what happens in your palms, there are all points of your body. Palms and the soles of feet. All the points are there. So when we press these points, no, that particular system gets relieved or that affects that particular part of the body. So there are various points are there in the palm and in the feet also. So Apana Mudra, this takes care of, because this is connected with the nervous system and that relieves the Apana Vayu. So that is why it is called Apana Mudra. Because in our hand, there are 5 elements. This is fire, Agni, this is Vayu, wind, this is Akash, space, this is Prithvi, earth, and this is Jal or Varun. So this is Agni. So when you press any element with Agni, that reduces. If you just press it, so while pressing, it will reduce. If you just touch it, it will increase. So if you want to increase the system in the body, that will increase. If you want to press it, so if we are doing this mudra, so we are touching fire with this space and Prithvi. So that is connected to our navel region and it will relieve the Apan gas or Apan Vayu. That's how it works. And if you press it, this is earth, or if you press it, this is called Surya Mudra. So this will reduce your weight because that will burn the fat in the body. So this is how the various mudras are working. But in headache, we have to do Apan Mudra only.
Yes, I was also asking the breathing. Are we just normally breathing through the nose, normal breathing?
Breathing, when we breathe, no, especially when we breathe deep, more oxygen goes inside. When we breathe completely outside or breathe out completely, carbon dioxide comes out. So in this process, what happens? Your body gets more oxygen. Carbon dioxide is relieved, it comes out. So you have more pure blood because out of the oxygen we are taking, 20% oxygen is used by your brain. So if your brain is, or if your breath is short, the more oxygen is used by brain. And if you are doing stressful work, the requirement of brain will increase and your body will not get oxygen. So what will happen? You will get elements, or there will be more diseases or lifestyle disease, we can say. But when you do this pranayama, your brain calms down, the consumption of oxygen and glucose is reduced. So whatever is saved goes to your body and your body becomes healthy. So this is how it works.
So thank you very much, Deshmukhji, for giving so wonderful session with all health, what we say, related informations, connecting with all the exercise and posture, also with breathing exercise, how they are affecting the different parts of our body, or sympathetic and parasympathetic system, how it is making balance in our body. So that you have done, they said very well and explained everything very clearly. So I think all instructions have been, what we say, followed or understood by all our participants. The videos of all these sessions would be available on Google Classroom. They can have access throughout the week or throughout the course. So they can practice the same thing at least for 1 week and can show us that what kind of changes you are finding in your health issues or in your body, mind, and also at emotional level. So this is, we are expecting from this particular course that this is not just for lecture or listening or getting informations, but you have to practice it at least for 1 week continuously at regular basis. You have to spend some time whenever you get time, either in the morning or before sleeping, but with an empty stomach. When you have taken dinner, meal, or lunch, avoid at least 1.5 an hour after breakfast and 3 hours or 2.5 hours after meal. So that will help you to get good benefits of all these yoga exercises, meditation, mantra meditation, hand postures, and breathing exercise. So I have already sent some survey forms. Might be you all have noted them. I would like to have those survey forms by the evening of today, so that we could come to know that what is the current position or current condition of your physical body at this moment, and after 1 week regular practice, what kind of changes you are finding. So that is the main purpose to conduct this practical course, to see that what kind of health issues are getting improved by following this yoga therapy or Preksha therapy. And that is very important for us for scientific study, for scientific research also. And I would like to see that our all participants are so sincere, they will practice it at regular basis and show the good results of these yoga packages or therapy. Yeah, these things are suggested that as a complementary therapy. You might have some already some medicine or some doctors or some health issues, and for that you have to consult with your doctors if you are doing something which is not prescribed or by the doctor, or which is not allowed by the doctor. So first you can consult with them, and then you can see that if these things are helping you to improve or to getting better health, that will be good or pleasure for us to see that our participants are being benefited from our programs. And the next session would also be on the same time on coming Saturday. So in each Saturday, for at least for 6 Saturdays, up to 15th of January, we would have these sessions for 2 hours, having all the practical sessions and also the theoretical part. And the doctors would also be there concerning to particular problem. So he would also be there. There are 6 or 8 doctors which are associated with this program for different physical problems. So Dr. Prakash Sancheti is already here. Dr. Pratap Sancheti is also here. So they will also take some class. but just I want to say that there is a very good good team of the doctors, which is who are associated with this particular program, and good yoga trainers. You can see Desmukh is he has already been in a pharmaceutical job, and he has all knowledge about the physical body, about body systems, and nervous system, endocrine systems, and other things. So that is a very good thing, very good asset for this particular foods. So I thank to Dr. Raj, also to Krishna Deshmukh for coming, joining, and giving wonderful sessions to our participants. And if somebody has any question, they can communicate with studies@jpi email, so that we could come to know if you have any other question concerning to any session, whether it is a session of Dr. Raj or me or Deshmukh. So hope it is beneficial for all of you. The syllabus is already posted. You can see that, and whatever is missing in the syllabus or any course content, we will add eventually as the session will finish and the videos will be ready. We will post all the informations. You will get all materials by the end of the evening. Okay, so that will be available throughout the week, and you have to go through that and practice. Same. Any question?
Before we leave, there is one question in a
Yes.
chat. In Appan Mudra, we
Yeah.
have to touch or a press.
We have to touch only. Touch the tips of these two fingers, middle finger with thumb. Don't press it hard. You have to touch, not to press.
Okay. Thank you, Krishna ji. And with this one, we can conclude our today's session. Vandami, please recite Namokar Mahamantra and fulfill it.
So with the Mangal part, we are concluding this session. Hope all have enjoyed the sessions and will continue the same. And this course is open again for at least 1 week after the course applications, Google applications will be closed. So if somebody is interested, you can inspire them and connect to them with this particular course. So I hope good number should be there for each of the sessions, and all those who are participating in this particular course, they should also be trained in the same therapy, so that they can also be a good resource person for this course, to give sessions to different age groups, different people in different countries, different places, cities. So with this, I recite Mangal part. Chattari Mangalam, Arhanta Mangalam, Siddha Mangalam, Sahu Mangalam, Kevali Prannato Dhammo Mangalam, Chattari Loguttama, Arhanta Loguttama, Siddha Loguttama, Sahu Loguttama, Kevali Prannato Dhammo Loguttamo, Chattari Saranam Pavachami, Arhanti Saranam Pavachami, Siddhi Saranam Pavachami, Sahu Saranam Pavachami, Kevali Prannatam Dhammam Saranam Pavachami. Thank you. Thank you for joining.
Vandami Naman Swami Samniji. Thank you very much.
Thanks.
Vandami Naman Swami Samniji.
Yes.
It was great to see you at the FIU event yesterday as well. I look forward to seeing you at the Jain Center on Sunday tomorrow.
Correct. Thank you.
Thank you for arranging this class. I wasn't able to attend in the past, but this time I made it. Thank you.
Okay.
Vandami Namaswami Kritagyosmi.
Thank you. How, Cheris, everything was clear to you?
Everything was clear. Very good. Thank you so much.
Okay. Thank you for joining. So if something is not clear, you can just communicate with email IDs, and we will come to you soon. Okay. Thank you. Now we are